All right, thanks for being here. So I'm going to take about maybe 20-30 minutes to go over like what we do with our office, because it's very different, as you can see when you walk in here. Our culture is different, and I've made it different in the fact that some of you may have already been told where my history comes from and why I get a little bit kind of compassionate and sometimes pissed off at the same time, because when it comes to the culture in our health, my mom didn't do much for her health and unfortunately lost her life prematurely. And here recently, 2 years ago, my sister at 47 also died of diabetes. And so why I take this topic pretty heavily is because of the circumstances that sometimes, I think God places them for a reason. And so I thank God for the circumstance of what I had to walk through or watch, because I wouldn't be as urgent. But understanding statistics, I don't have to give you heart disease and cancer are the top leading killers. But the reason why I have you here is to understand that the number one cause of death right now is what? What's the number one thing that most people typically die from now? That's not even a disease. And this is my mom, and this is my sister, and now even my dad. And I tell you this, guys, because everywhere you turn, like this article here, Time magazine, they questioned doctors. They said, what scares you most about being the doctor? And it literally says here, being the patient. And so the number one cause of death right now, and why they say this, is like they have pharmaceutical reps sit in their office waiting to give them the newest and latest drug for whatever just popped out in the market. And unfortunately, as soon as you come in with that stuff, what are they going to give you? Whatever they just got told that's going to help you. And so this is where, the number one cause of death is no longer your disease, but doctors are saying it's what we give you. And it's not that their intent is to try to kill you, but the reality is that these companies now are even telling our patients, hey, ask your doctor if you have this, get this. And so we live in a culture where we're indoctrinated and brainwashed that health comes from a pill. And so this is where there's a time and place for drugs, don't get me wrong. I think that it's a thank God system. My dad had a heart attack, and he luckily is still here because an amazing doctor saved his life. But when he had his heart attack, he was mowing his lawn. He felt great that day. No clue he had problems with his heart, and he fell over the heart attack. And so this is where my uncle, of course, found him. He went to the doctor. He's still here, but the doctor went in there and said, you know what, your dad had several occluded arteries, but he had no clue because there was no what? There was no sign. And so this is where cancer and heart disease, cancer is the same thing. I don't know if you guys know people who have cancer. They have a 3-inch tumor, but they had no clue because there's no what? There's no symptoms. So I guess I want you to get that when it comes to health, if you're basing your health on how you feel, that's not what health is. And then you have the other extreme, and I see a lot of a wellness crowd. I work with Olympians. I don't know if you guys know, I went to 2012, 2016 Olympics, work with wrestlers. And I'm going to go to 2020, and I love working with these teams, and I keep doing it. But they're the hardest people, like athletes and the wellness crowd, because they base their health on what? How they look. Most of the time I exercise, I look good, so I must be healthy. And I'm not telling you not to eat nutrition and good stuff like whole foods. That's all great ideas. But what I want you to get is that does health come from what we do? Because for instance, if I take this dead person and I feed him all the right juices, would he be able to utilize those juices? No, apparently, because he's what? He's dead, right? So this is where what creates health, what allows you to assimilate every nutrient in the body. For your heart to beat, for you to digest the food, for your liver to detox. What makes everything run?
Works together.
What's that?
If the whole body works together.
Okay, so sometimes people say that your body or your nerves. But let's say this guy has a brain, he doesn't hear, but he has a brain and a nervous system, and we both have cuts, who still heals? Even though he has a body, he has a brain, a nervous system, who still heals? Logically, who? Me, because he's dead and I'm alive. And I want to get back to simplicity, guys. And this is where the big idea is that what happens if you're alive, can you heal? Of course, right? 100% or 99%. Because sometimes people start to lose this faith that their body can heal, because as soon as they get slapped a diagnosis like the big C, cancer, sometimes we have more faith in this cancer than that power that God put in the body to heal. And this is where I always go back to, is that you have a power within you right now that heals you, that from 2 cells, you didn't need a brain to tell it what to do. That power that's within you starts to grow to 4 cells, and before you know it, you're growing this embryo with a neural tube. That's the first organ that forms. But then 22 days later, you get the heart that beats, your lungs, everything starts to work. But for it to do that, what has to be transmitted through these nerves? That life, that power, right? So if I cut the nerve that goes to the heart, what would happen? It's that simple. And it's not like it's a belief system. It's a law. You fall off this building, what's always there? It's gravity, right? The ground. So it's a physical law that there's a power within the system. So this is where, when it comes to understanding the spine and why I take it so seriously, is that the nervous system carries that life. First, number one, you have to believe that you can get better. You're not going to have an expiration of 3 months, like if they give you a cancer diagnosis. Because the minute you decide that you're going to die in 3 months because they told you, what happens? You die. So first, number one, when it comes to health, you have to own it. You have to believe, I can heal. And anything else that tells you different, as a man thinketh, so he is, right? But then physically, you have to have a functioning nervous system. And then, of course, you have other factors like eating more God food than man food, not all these toxins. So it all matters. Exercise. So we call them the 5 essentials. These are the things we teach. But the whole intent of chiropractic, like some people go to chiropractors and have no idea why they go. And typically people go for what? Most of the time. Most people go for pain, yeah. And so what I want you to make sure you understand with our office here is we try to make sure that you understand what you're looking at on your x-ray, because so many times people look at an x-ray and have no clue what they're looking at. So from the front, the spine should look straight, okay? From the side, you have these 3 curves. And anytime you start losing these curves, like now more than anything, what's happening with our spines is our heads are diverting forward, and cell phones technology is doing that. So now what's it going to be putting pressure on? What's that yellow thing back here? Your brainstem. And you guys know Christopher Reeves. I don't know if you remember his story. He severed his spine after he fell off a horse. And if you remember him, he was paralyzed, right? But if you recall, everything shut down, because that area where he broke it, that nerve actually severed and it shut everything down. So literally he needed, man went in there with their wisdom. They put machines. They kept this man alive with respirators, pacemakers, all this stuff. Thank God, right? 9 years, I'd take it. But after 9 years, what did he die of? Maybe you don't recall. It's like about 50. Everything started to rot. He had heart disease, pulmonary disease. Physical therapists would pump his gut. The thing is that his brain wasn't able to actually tell those cells to make new cells. So he was literally rotting from where? Inside out. So this is where mechanistically man can do amazing things, but it'll never, ever, and I want to tell you this, I don't think man will ever replace that power that's already within you that tells your body to heal. So this is where we want to make sure there's no pressure on the nervous system. And when you look at an x-ray, like a normal x-ray, this is a normal curve, like of the neck right there, okay? What happens is when you lose that curve, and this is an MRI, you see the spinal cord, okay? When you lose that alignment, that subluxation, our head starts to shift forward, kind of like this guy here, and it puts a load on the spinal cord. So what's the function of this person compared to that person? Less or more? Probably less, right? The problem here is that there's no what? Kind of like a clogged artery or a tumor. Most people have no idea that this is going on because there's still no what? The body's brilliant. It's resilient. And so this is phase 1 here. Like this is a normal disc. And phase 1, you start to lose that because it starts to lose that curve. The disc starts to compress. the reason there's no pain is because, see, the nerve's still patent. I mean, this hole's still open where the nerve's not getting pinched. But maybe there's a little stiffness. And what do most people take? Or they ignore it, or they take a vitamin called Advil or something. You know what I mean? And so people either ignore it or they drug it up. And then with time, and this is after years, as that load starts to increase on those joints in the neck or the low back, you got degeneration. Then now bone rubs on bone, your body gets more compression, so you get like what they call degeneration, arthritis. I don't care what they call it. Mainly it's now what's happening to the nerve. And it's getting pinched, and so therefore it's losing what? What flows through that life. And so then you start wondering why that arm's falling asleep or the leg's falling asleep, or sometimes as we get older, then you're wondering why you can't go to the bathroom, or you're dribbling, or you're, gut issues or sex issues or thyroid, whatever the case is. Now you go to the doctor and they look here or here. They're going to start digging over here, and then what? They label it, then they give you and if that doesn't work, it's another drug typically. Now that doesn't work, they'll just say, ma'am, you don't need your thyroid, your colon, we'll just rip half of it out, your uterus, well, you don't need that. Here's these drugs for the rest of your life. And not, guys, I'm describing here my mom. I mean, God doesn't care about the physical, but I will never forget that one moment where we were like, I was about 10 or so, and my sister was about, older than us, and we had to take care of her, and she's screaming from the end of the room because she's in so much agony and stuff. And I remember that it was also because she was just, we had to change her diapers. Could you imagine being 48 having to depend on your kids to do that for you? And I would do it again and again if she was here, but that's not what's supposed to happen. And this is when we had to relive this with my sister at 47 when she died. This is when it woke me up again. There's people that are sick, suffering, and dying out there waiting for answers, but people aren't waiting to do anything about their health till it's too late. So this is why with this office here, it's about making sure that you're living to the potential that God gave you. And that's why I'm going to tell you it's not for everybody. And it's okay if this is not the place for you, because what we try to do here is we try to turn you the other way. Because out there, who's teaching people about health? It's these companies, guys. I mean, literally, I don't know if these pharma companies, that's who's running this world. I have all these drug ads, I can't find them, but everywhere you turn, on the back, it's all the side effects. And if the thing is that people start to think that this is the only way to health, that health comes from a pill. And so this is where we start showing you how to start living the 5 essentials, how to start removing some of these toxins and stuff like that. But everybody wants everything what? Quick. And this is a journey, and that's why I'm saying it's not for everybody, because they want the quick stuff. Here it's about showing you what to do with your spine too. Like for instance, when we look at the x-ray like we talked about, you want to see that curve. And now if you see this x-ray here, and this is little Jesus, so this is what normal should look like. You have this 43 arc in the neck. This is his. What do you notice? So it's pretty straight. See that? So that's subluxation. And this little kid had seizures. I don't know if you've ever had to witness one. It's pretty scary, but he would get them a lot. And his mom finally was referred here by a patient. And he was, at this time locking himself in his room because kids would make fun of him. Anyways, long story short, he was on all these medications because of the seizures and blah, 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 headaches. And she's like, well, I don't know why the doctor didn't tell me that he had problems, and you're telling me he has problems. And well, what are they looking for in an x-ray? They're looking for what? They're looking for fractures, tumors. And I have to look for that too. There's a tumor or whatever. But if there's nothing that they can find on that, then they're going to say it's normal, and they'll just give them a drug for it. But I want to look at structure too. As an architect and engineer, we look at things differently, and there's pressure on the cord. I don't know if I'm going to help them. Really, I don't know if I'm going to help you. The thing is, we're going to do what we can to remove interference. Not to mention also the Fruit Loops and the pop and all the chemicals from the drugs. Who knows? But do something. I'm like, at least try somewhere. And so she, she's like, well, how did he get like that? I'm like, I don't know. Maybe I always start at birth, because nowadays with most kids the moms are being induced and kids are being yanked out. So that's exactly what had happened. We start working with him. I'm like, we're gonna just have him start doing some things himself. So like the head weights and all this kind of stuff that we had you guys do, it's all about restructuring the spine. So we give you tools, kind of like a backpack. Your body doesn't do this with the weight. Your core reinforces. So if you're forward, you put weight here, the body reinforces that curve. So the goal is to get this curve back. With a kid, it's easier because there's not a lot of degeneration. So that's what I love seeing kids. I mean, not that I want to see you guys, but they're so much quicker. So about 2 months later, the seizures were there, but they're not as often. The mom's all excited because the doctor's weaning him off some of the drugs, and I'm excited about that, but I want to see what's going on, not just about symptoms. And so this is the best, we got him at 2.5 months, and it's pretty much to the point where if you notice from here to here, what do you notice different? It's that curve, but also the atlas is up. It should take pressure off of that brainstem. But this I expect at kids. I'm not showing you this for the results. Kids respond quickly and pretty easily. It's more about the story, guys. I mean, this kid, like I said, I start talking to him. I'm like, what do you think, buddy? He's like, I can play soccer. And I'm all excited about it. I'm like, don't you play soccer? You're 12. He's like, no, the coach, I love soccer, but the coach wouldn't let me because I'm a risk to the school. Could you imagine being made fun of your friends, and now your coach is telling you you're a risk to the school? I'd be depressed, you know what I mean? And so this is where living that life you want to live is what this is about. This is why I love these stories. It's not just the results we get, it's about people getting to where they need to be. Then we brought them down to once a week, then once every other week, then once a month. And now, the tools that we give you, a lot of these exercises you do at home, it's kind of like brushing your teeth and flossing. The goal is that we then have you take care of your spine and you're not just depending on me. And then, of course, along the way, we showed them how to eat better, got rid of the toxins. That's what this is about, guys. The nervous system, this is just extra stuff we do, okay? Now, as far as an adult, like this guy, about somewhat you guys' age, so in his 40s, you're probably not that, but this is what we see with this guy. What do you notice? So now you know what I'm going to be looking for, structure. So it's curved the other way. Now he had car accidents that had weakened his ligaments, so you start getting this reverse curve. That's kind of harder to fix. And watch what the body is doing here with this bone spur. That body is actually doing the right thing at the right time, trying to fuse that, because what's more important, the joint or what's back here? The spinal cord. And so he had these, see this atlas should be up like that? That's the one Christopher Reeves broke. It was putting pressure where he was getting these migraines. And if you've ever had a migraine, it kind of like you don't want to have anything to do with the world. And he's like, can you help me? And once it gets reversed like that, it's like you just really got to be active with the exercises. And so, of course, that re-x-ray after a couple of months, this was so my bad. That's why I explained this to you, because I said, hey, because nothing changed. So what are you doing? Are you doing your exercises? And he hadn't done them. And of course, it was my bad because I never nagged him to. And I was kind of afraid of people back then. Now I could care less what you think. But so this is where, I gave him a couple more months and he actually started doing them. And about phase, he was happy he was off of Burger King. And we want you to do the nutrition, guys, but this is what's going to create the change, your nervous system. So this is where after, the 4th month after, because he hadn't done his exercises, how we got from -25 to now, actually, no, it was this one here. So that one's even better, but this one's just straight. So that bone spur still there, but a little bit better, okay? So when we cut them down to maybe once a week, once every other week, about the 6 months, this is the best we got them. And if you notice here, what do you notice with this atlas compared to this atlas? You see how it's flatter? So this is where we were really seeing lots of change because we were starting to get that atlas corrected and taking pressure off of what? What's the most important thing? That brainstem, that spinal cord. So he brings me this, and I show you this because these are the things, guys, and I keep a lot of these bags everywhere. Because these are my anchors. I mean, this was the first bag I ever got. Now, when I tell you they're my anchors, is because the first time I ever got a bag like this was this guy. And this was 20 years ago when I started my practice in Caldwell. But I remember him bringing this, and I'm like, Daryl, what is this? I thought he had migraines. And he's like, no, you don't understand, I couldn't sleep. I had anxiety, I had depression, I had been given all these drugs, and I don't want this stuff. And please don't just go get off of this stuff on your own, guys. There's a way to, we work with doctors to help you. But I'm like, okay, we're off of them. Can I keep this bag? And the reason I keep it, guys, and I always look at these, is because this is what anchors me. This is my mom, and this is why I do what I do. I mean, you guys matter, and this is what this is about. And this testimony he gave me, and we see a lot of these, like that's that guy. He's off of those meds, great, but that one line is what matters to me, is that I thank God for meeting Dr. Rosie, because now I could be the dad I want to be for my daughter, Nyla. That right there is what it's about. It's about you living to your potential, guys. And this is where I can go on and on, but hopefully you guys get this, that it's about changing the way you live, and most people hold back because of what?
It's hard to change.
The what?
It's hard to change.
It's hard to change. The fear, the time. I've heard so many things, guys, the money, and I understand them all. It's hard to change, but it's about shifting, and you do got to change. The time, I can't, you manage your time, but I'm going to tell you, my mom never did. She's no longer here. My sister, you know what I mean? This is where we don't look at our health until it's too late. I have people who come from like Vail and Mountain Home and Twin Falls, and typically we start people at 2 or 3 times per week. I'm not going to expect that they're going to come 2 or 3 times per week, but at least that they're doing what they can, even if they come in once a week, whatever, but that we give them the tools that they need to do to also be at home, but commit to that stuff. So, but the money thing, guys, if you were to go to a chiropractor, a nutritionist, an exercise physiologist, PT or whatever, a toxicologist, you put it all together, all those services, how much would that be in one visit? 1,000, I don't know, chunk of change, right? Times maybe 12 visits if you're a phase 1, or if you're a phase 2, 24, 36 visits, that'd be a lot of money. One day in the hospital, though, I mean, you're paying a lot of money just to test, you know what I mean? So this is where I'm not here to charge you a lot of money. This is where we make things doable. If you walk in here, you'll see different, walks of life. We see single moms of 4. We make it happen for people. But if I'm going to bring these services to the point where it's doable, I want to make sure that I'm seeing people who truly want to be here. And this is where I ask for mainly 3 things. And one is that if you're going to be here, that you want to be here. That my staff is not here to, like, where are you at? We don't, we give you a calendar, you make your appointments, and we start you at 2 or 3 times per week the first month, then we can go to once or twice, and but we're reassessing, but you do your stuff. We also do workshops. We're always going to tell you, hey, you know what, come to this workshop, start to learn this stuff. You come to what you can, but that you at least do some stuff. The second thing is we check families. Like, I would not ask you to check your spouse or your kids. Like, what they want to do after that, that's their thing. But we check them on us, okay? And that's where we make family care plans, and we try to make it work, okay, for people. And we see many families. So, but that you ask them. I take my faith like I do, my practice like I do my faith. I tell people about Jesus all the time. And when they're ready, they're ready. If not, I move on to the next person. That's how I take my job. I'm going to tell you, hey, have you gotten checked? Has your wife? I'll ask you all the time, or my staff. And then that's the third thing. The third thing I ask is that we do events all the time. And all we ask is like, hey, here's a flyer, invite your friend. I don't know, maybe they'll learn something at the dinner we're having. We do like these free dinners or whatever. They get free dinner anyways if they don't want to, whatever. So this is where we're kind of a life-saving office, and we're on a mission to seek and save that which is lost. And that's where we're always going to tell you who else, who do you know, where else. So that's what I ask. We're going to help you, and we're going to try to figure things out financially to make this work, that you at least are committed. And the question I always get in there, typically with finances, is like insurance. I mean, if you understand insurance, where are they at with the medical model or health, like wellness, like eating right, or are they into sick care? They're still, guys, I don't think anybody's going to change that. They're still about paying for only when there's crisis, right? And so with chiropractic, typically they pay, typically not at all or very little. And so let's say you need 24 visits or 36 or whatever for your care plan. They're probably only going to pay maybe the first 8 to 12 visits. But the rest is up to who? You guys. So this is where I kind of did away with insurance years ago. If you have it, you know, that maybe they'll pay the first 12 visits. We'll even bill it for you, but you get reimbursed because we're out of network for everybody. But we'll bill it for you, try to help you out. But we only bill the first 12 visits that typically are called medically necessary, that they allow. But for the corrective phase, the other stuff, most of the time they're not going to cover that. You guys are responsible. But what I typically do, and I can because I don't accept insurance, I can discount whatever I want, and that's what I do. I either discount it or write it off. Like, I don't charge you for nutrition consults or exercise or, you know, detoxing. We put it all as a system, and that's how we make it very affordable for people to get the care that they need here. And that's where, you know, when we go in there right now, we're going to go in the order that you came, and it takes about now like 5 minutes, and the main question I ask you after I show you your x-rays is this really something you want to pursue? Because if it is, you know, we're all in to try to see what we can do when, you know, we go forward, and let's see what we can do. If not, that's so okay. I'm gonna, like, don't dodge me at Walmart when I said no to Dr. Rosie, you know, I'm gonna love you no matter what, you know. But my biggest fear is that you do nothing. That, in other words, I see you at Walmart, and before you know it, I see that you're at a second surgery or another drug, or, you know, that there's so many things. Never lose faith in Jesus. You know, he's your healer first and foremost. And then second, you know, just act, faith and act, you know. And so that's all I have, guys. I don't know who was here first, but we'll go ahead and take them first, and I'll be right with you. Okay. So if you guys want to go in that room and